don't know if anyone in this audience will be familiar with this method or not, so I'm just gonna like spell out the method and then we'll fill in the details later. Oh, replacing the entire thing. All right, so I'm gonna talk about how we use respondent-driven sampling for improving the point-in-time annual counts in King County. This is joint work with a large team, myself, Zack Almquist, Amy Hydrocan, who's waving up in the back, and then there are some colleagues from King County Regional Homelessness Authority and the Lived Experience Coalition that worked on this. So the first thing I want to do is just get us all on the same page. The last talk talked about this. How do we count people experiencing homelessness in the U.S.? There's a lot of variability on local counting by continuum of cares and local organizations, but as far as like a big national count that tries to be as sort of harmonious as possible, really the only thing that exists is the HUD mandated point in time biannual count of the sheltered and unsheltered unhoused population. And so one thing to remember about this, and I think this is probably important in a public health setting, is this is HUD's definition. If I had slides, HUD's definition of homelessness is really, really strict. One of the most obvious ones is like the doubled up population doesn't get counted. There are a couple like key terms as we go forward. One of them I've already brought up, right? Continuum of care. Continuum of care is HUD's organization for distributing money across the U.S. as well as generally providing sort of geographic boundaries of care for local groups. Overall, the continuum of cares almost cover the entire U.S. Again, if I had slides, you'd see a nice little map, and what you'd notice is there are little white holes on the map, and those little white holes are places where there is no continuum of care. And so that, you know, it's good to remember this doesn't actually cover the whole U.S. So while everybody talks about the point in time count being an undercount, it's like even very formally an undercount. You know, one of the key features of the Continuum of Care program started more or less in 2005, but the count doesn't really start until 2007, is HUD mandates this lead organization to attempt to enumerate the total unsheltered and sheltered population. So there are a lot of ways the point in time count is actually done. You can go on the HUD's website and look through all of the various rules and stipulations and see how each local group does it. Most groups largely do it in something modified this basic way, which is they take about 6 to 12 hour period at the middle of the night on one day in January. They go out and try to visually count every person that they can find who is sleeping outside. And then for the sheltered count, they use the HMIS database and local care clinics and stuff, and they do an administrative count. So the general sense, right, is the administrative count is pretty good. The unsheltered count is for a lot of reasons to be thought to be pretty limited. All right, so one of the things that really came up with the point in time count was COVID really impacted it a lot all over the US. One thing that's particularly important for King County is they didn't conduct the point in time count in 2021. They got a waiver to not have to do it. And so there are a number of people who've tried to illustrate all of the different problems with the point in time count and various other solutions. One thing that Sai and Alcon mentioned, and I think this is very important for this particular case, was that the HUD allowed people to do different things for the point in time count. They gave people permission to do changes, and this is sort of really key for why we were able to run a respondent-driven sample to estimate the total number of people experiencing homelessness, at least studies for the unsheltered population in King County. So King County Regional Homelessness Authority is the new lead COC organization. The one before it collapsed for a variety of issues. They had taken this on, and one of the things that came up was they actually thought they were going to get a waiver again for not conducting the 2022 point in time count. However, HUD, as many of you I'm sure are aware, came out and said, no, everybody has to do it. We need to get our baseline back going. And so King County Regional Homeless Authority pivoted fairly quickly from a large-scale qualitative study that they'd been planning to point-in-time count and a large-scale qualitative study. And they did this in conjunction with the Lived Experience Coalition at the University of Washington. They provide all the volunteers for the interviews. So I just kind of want to talk a little bit about kind of the history of how this came about. I think it's important. So King County Regional Homelessness Authority, they're prepping for this large-scale qualitative study. They were especially worried because people hadn't been out talking to the unhoused community over COVID-19, right? It was particularly a known time. And so King County Regional Housing Authority wanted to consider a bunch of different options for the point-in-time count, and they really wanted an option where they could continue to do this large-scale qualitative study that they've been planning. And so they reached out to a number of people at the University of Washington, who brought in people from some other universities, and we all kind of chatted. I was the one who suggested respondent-driven sampling for this case, one of the reasons being that the way that it sets up the sampling frame is it sets up a very nice sampling frame also for the qualitative study. And so they ended up putting together very quickly, within a couple of months, together this respondent-driven sampling. It was impressive. All right, so just to make sure we're kind of all on the same page, respondent-driven sampling is both a sampling strategy and a set of statistical estimators for measuring hard-to-reach populations. And so in this case, the really key feature for us is it provides a method for effectively a probability sample when we don't have a sampling frame. So in many contexts, right, when we do polling and surveying, we need a sampling frame. We have a list of addresses and we take a random sample of addresses. We have a list of phone numbers, we take a random sample of phone numbers. For those of you old enough in the audience, you take a phone book and you just randomize it. You can't do that with this case, right? We don't have a frame. And if we did have a frame, you might argue we don't even need to do this, right? Because we would at least have a full enumeration of the group. This method has a number of other key features that are nice. It leverages peer recruitment to limit things such as stigma and discrimination, lack of trust. In fact, we use the Lived Experience Coalition to do this in a trauma-informed way. Analyzed correctly, it provides a low or unbiased estimate of the key percentages and totals. It's a popular method in public health settings. The CDC, NIH, World Health have funded many of these studies. The original studies were mostly focused on counting people at AIDS or HIV. So there are a couple of key innovations. There's the big thing in the respondent-driven sampling, right, which allows us to have this principled sampling frame where we sample over a social network. There's some assumptions in there, right? We're assuming a certain amount of connectedness between people experiencing homelessness. And it's got these statistical estimators that have been well developed over the last 30 years. The respondent-driven sampling in King County also added, I think, some novel things. So we working with the Lived Experience Coalition, who provided all of the interviewers. I think it was particularly nice. It allowed for this very trauma-informed, positive handling. And it also, I think, managed to help people really have trust in what was going on. And then we go on to leverage the known shelter count data from the HMIS database and the final count to produce our final count of unsheltered population. So it's kind of nice to have like an illustration. So here I have simulated a network of unhoused people experiencing homelessness and unsheltered specifically, set in Nashville, Tennessee, based off of a sample data set from one of my students. And so from that estimate, I can simulate out a complete network. And then on this network, I've simulated out a respondent-driven sample just so you can visually see what's going on. So seeds are the initial people, the first people interviewed. They need to be in the target population, right? The unsheltered community. And then the reds are all the people who are referred. So we use coupons to track who in the unsheltered community is referred to by whom. And then obviously, right, it's a sample, so not everybody's sampled, and that's what the black nodes represent. And then so if you unwrap this procedure, you get these tree-like structures, right? And so the more waves you have, the better the estimate. Formally, oftentimes people use an illustration like this, right? This tree structure. So we have our initial seed, and they were given 3 coupons, they recruited 3 people, and then each person themselves can recruit up to 3 people, so on and so forth, and so you get K waves, and this produces our final respondent-driven sample. All of this relies on coupons. Another sort of key feature of respondent-driven sampling is that it's typically done with a hub. So they set up permanent or semi-permanent locations, and the coupons are put out, and people come and have their interviews at the location, get new coupons, go out. All right. So to kind of get like a stronger feeling about this, I wanted to talk about the comparison between the 2020 count and the 2022 count. The last time the classic point-in-time count was done in King County. So obviously, right, you have actually about 1,000 volunteers for King County that go out and try to visually inspect everyone. And then in this case, right, we had a bunch of hub locations. They tended to be in libraries and other community areas, and they were operated for more than 2 weeks. All right, so nuts and bolts. The count in 2020 was conducted from 2 a.m. to 6 a.m. on January 24th, about 1,000 volunteers. And then there was a follow-up demographic survey. They actually had a lot of trouble with the 2021. But the key feature that I want to pull out is they tended to go to day use and shelters to get the demographic survey, which is sort of definitionally not the population that we were trying to count. So that's like highly problematic. So I'm starting to run out of time, so I'm going to just go over this briefly, but there's a lot of basic problems. They center around this issue of things like we know that rain makes it harder to count people. Well, it's January in Seattle, there's lots of rain. There's visual obstructions. It's a complex area. You have urban, rural, and suburban environments to deal with, huge organization and task. And there isn't this like natural way to set up this large scale qualitative study. So what did we do? We counted the total number of unsheltered population directly from the RDS. We estimate all of our demographics directly out of this RDS survey. So as I said, right, it provides this basically probability sample. It provides a way to generate standard errors, and it leverages this peer recruitment. So in practice, what did we do? We conducted the survey for 1 month from March 9th to April 6th, set up 9 hub locations based on previous PIC counts, feedback from people with lived experience, and the general care community. So each hub was staffed with 1 King County Regional Homelessness Authority worker, 2 to 5 LEC volunteers, that's the Lived Experience Coalition. They tended to be in libraries and community partners. They were operated for at least 2 weeks. Each hub was separately seated. An incentive of $25 was provided, and then respondents were recruited via coupons. So the coupon looks like this. They provided bus passes and maintained everything on a spreadsheet. Altogether, we got 671 total interviews. I like this quote from Owen in the Washington Post. He interviewed somebody who was actually living in the woods, so we really do get kind of deeper into the population than we normally would. So total results, we had 671 people. Our longest chain was 8. We have the unweighted data. It is kind of unsurprisingly predominantly male, and sort of breakdown that is more underrepresented minority population than you would expect in Seattle, but is kind of expected within this population. So in practice, I'm going to leverage this organic heckathorn estimator that's been around for I think about 25 years, and a little bit of algebra and the sheltered population to make an estimate of the total unsheltered population, this 7,600 number, and then we estimate out proportions using the RDS estimator to get these breakouts. One of the nice things is we get a few additional statistics. We can make some local regional estimates. We can estimate how many people were living in their car or RV. So I'm gonna wrap up real quick. A lot of this worked really well. We got the final numbers. We put them out to HUD. Working with the Lived Experience Coalition, I think was extremely cool. There were a few things, the timing was done so fast. The software that we'd hoped to use didn't work, so we did everything by paper. I think there's a lot that could be leveraged there, improving. The question of like continuing on the qualitative study or not with the count, I think is a little bit open. Right now, the current plan though is to do another qualitative study and pit count simultaneously using the RDS method in 2024. I think one thing that I really want to call out for people who are wanting to do alternative methods to the pit, doing a change is a big change to the community, and a lot of the outreach workers and stuff really liked the classic pit where you brought 1,000 people together, and so you lose that community event in this strategy. So I think there are lots and lots of advantages, but there's a lot of socialization that has to happen for this to be like practical, and I know that's one of the things that King County Regional Homeless Authority is really thinking about. That, thank you.